Hi, everybody. I'm Michael Carrese, welcoming you to Raise the Line with Osmosis from Elsevier, an ongoing exploration about how to improve health and healthcare. According to the Bloomberg School of Public Health at Johns Hopkins University, women make up 70% of the global healthcare workforce, but hold only about 25% of leadership positions. Well, our guest today, Dr. Roopa Dhatt, has been a leading voice in the movement to correct that imbalance through co-founding an organization called Women in Global Health, which has established chapters in over 60 countries since it started a decade ago. She's also pursuing that agenda and addressing other pressing issues in healthcare as a young global leader at the World Economic Forum. In addition to her work on the world stage, Dr. Dhatt is a practicing internal medicine physician in the Washington, D.C. area, an assistant professor at Georgetown University, and she serves on multiple high-level advisory boards. And thank you so much for joining us today.
It's wonderful to be here with you.
So we always like to start by learning more about our guests and particularly what got them first interested in medicine.
For me, it was really a childhood dream. I was 9 years old and not necessarily a pleasant dream that kicked it off. I have dualities. I was born in India, but was being raised in the U.S. And it was around the age of 9 that I was visiting my grandparents for the summer, and I ended up getting really sick to the point where I needed to go visit a hospital. Multiple doctors had seen me outpatient and they couldn't figure out exactly what was going on. So I ended up needing to go to a hospital. And it was during this hospital where it was discovered that I had appendicitis, and septic appendicitis had burst in my stomach and I needed emergent surgery. This was in the early 1990s. So India looks very different today than it did in the 1990s in this particular part of the country. And I was very fortunate that there was a pediatric surgeon who was able to do emergent surgery on me. And my parents, unfortunately, could not make it in time. So I was with my grandparents and went through this life-changing experience. And it was less the surgery, but more the weeks that followed where I was spending time in a pediatric clinical ward. It was one of those wards where there were at least 20 other children beds all in one very large room. And it was a very formative time for me as I learned about the life stories of other children, some that were younger, some that were older, and how there was all this inequity around. And a few months later, after I'd healed, I flew back to the U.S. and again continued my recovery process and found, how can we be in this world where there's just such stark differences in the realities that children have, that health systems have. And so that's what inspired me to be in medicine. And I was, yes, that 9-year-old girl who was determined and said, I'm going to be a doctor. And since someone saved my life, I'm going to do the same. And it's been an unrelenting journey for me since then.
That's a wonderful story. I mean, unfortunate circumstances. Had you given a thought to medicine before that at all?
No. I think like most kids, we have, those dream professions. So I wanted to be an astronaut. I was always fascinated by science. So in one way, you could say the path was already being written. But at that time, I think I was very fascinated with space.
So you obviously go to medical school and you're getting exposed to all these different specialties. You ended up with internal medicine and have been a hospitalist. So talk about that path.
My first pick at medicine, I wanted to be a neurosurgeon, pediatric. That was at probably the age of 13. I even printed out business cards.
Oh my gosh, that's adorable.
So how did I go from, this pathway from surgery into internal medicine? For me, it was particularly in medical school where I recognized that when we're trying to provide health for our communities, it's really a systems issue. And I find that internal medicine gives you the skill set to be able to connect with every specialty, know enough about how they're approaching things to be able to have that understanding. And then as you think about the people that you're taking care of as a physician, people are interconnected. It's not just one organ or one specialty that they're facing their health and well-being is all interconnected. And so internal medicine, I found, gave me the skill set and the ability to really approach whole of person care and really get to know my patients. And so that's what brought me to internal medicine. And I would have probably taken the pathway of primary health care, since that's where you can build lifelong relationships with your patients. I turned to hospital medicine at a time where I was trying to integrate having a career pathway in global health while also remaining clinical. It was really important for me to be able to be grounded in patient care, be part of a health system. And so hospital medicine gave me the ability to be able to do that, be doing shift work, which I can come into the hospital, provide critical services, yet it's not disruptive to the well-being of the patients I'm taking care of. So that's how I ended up in hospital medicine. And the time that I knew that this was definitely where I felt at home was during COVID-19. I was in the process of letting go of all my clinical appointments, and we'll get to the story of the international NGO I founded. But this is the time period in December 2019 when we had received our first seed grant. I was like, all right, this is a sign that I need to shift focus and focus on building this international NGO. And 3 months later, again, unfortunate and series of events, but the pandemic, COVID-19 pandemic, was announced, and I was seeing here in Washington, D.C., what was happening in New York City and talking to colleagues from all around the world. And at that stage, I said, I have the skill set. I'm a recent graduate, and makes completely no sense to say I'm working on global health issues, especially issues related to health workers, and I'm not in the hospital system while we're facing this pandemic. And so that is when I joined hospital medicine at 2 different hospitals in Washington, D.C. to help prepare for the potential surge and to be part of the COVID-19 response.
My goodness, what a time to dive in like that. So, but at that point, you'd already, you said, started forming the NGO or laying the groundwork for that. So when did you start latching onto this issue of women and leadership in healthcare?
Yeah, so I was in clinical training and in my internal medicine residency in the international health track. I had already come from student leadership globally. I was the former president and vice president of the International Federation of Medical Students Associations. It's a mouthful. It's an federation that's been around for 75 plus years. And I had been involved in that for 5 years. And so I was already introduced to the global health scene and doing global advocacy on issues such as climate change and sustainable development goals. And so I entered clinical training residency in the Midwest of the United States. And at that time, I found myself asking similar questions that I did when I was in my global health advocacy field is, how is it that we can be in a field with so many talented women? I saw women health workers, women physicians, women at every part of health delivery, as well as part of the global health advocacy space. And yet, when I took a look at leadership, I didn't see anyone that looked like me. It was that pattern we talk about: women deliver health and men lead it. And for me, it was so stark as a aspiring young leader wanting to shape and be part of the solutions that we were putting forward around the world, and seeing myself as part of that, global leadership. I found myself asking, what can we do about it? And that's what sparked Women in Global Health in me. And I was looking to connect with other people, and I found 3 early career women, 2 of them online, and one of them that I already knew from my student days. And 2 of these women were at a global health conference, and they were tweeting about an all-male panel. And instead of focusing on the problem, they were talking about it. And this was when X was formerly known as Twitter. We're talking about what are the solutions we can put forward. We know there's so many talented women. There's more that we can do. So I direct message or DM them and found that we had common contacts. And within a couple of days, we hopped on a platform that most people probably don't recall, but Skype.
Right.
It was the Skype days before Zoom.
Right.
And we found ourselves, deep in conversation and connecting weekly about, what can we do? And a few months later, we decided to go to the World Health Assembly, which takes place in Geneva, Switzerland, and it's organized by the World Health Organization. But it's an assembly that brings governments together, which are called member states. And we used our different connections to go to the World Health Assembly, and we did a consultation at a coffee table in the United Nations office in Geneva called the Palais. And about 25 people showed up throughout this consultation. And as we brainstormed, how do we approach this challenge of gender equity and global health leadership? And us in the health field, we love conferences, we love reports, and we, like to have working groups. So all these different ideas were being put forward. And what really stood out was that we needed a global movement, because it takes movements to really transform societies and communities. And so that's how Women in Global Health was launched at a coffee table, sparked by conversations that were taking place online, really bringing visibility to the fact that women are in our field and there are many talented women. So we don't have necessarily the same talent pipeline issues as other sectors. And how do we really change the equation of women delivering health, but also being viewed and valued as the leaders that they are in the health sector?
Yeah. So what did you identify at the time as the main reasons, biggest barriers, and how did you go about trying to tackle those?
It's a really great question. We did still go back to our roots of being health people. So we did spend time doing research and convening and you really going deep into, what is happening here in the health sector. And we had our landmark report, which is a World Health Organization report that outlines this in greater detail, called Delivered by Women, Led by Men and Gender Equity Health Workforce Analysis. And you can find that at the World Health Organization's database and website. And in there, we outlined several key areas. But first was really around leadership. Our sector, the health sector, has a very pervasive norm and gender norm where women are expected to deliver the health, but not viewed and valued as leaders. So for us, really transforming this mindset, bringing visibility to women's contributions at every level of health system. What we did is that we quantified what women's contributions in the health sector look like. And we built a leadership pyramid that showed that the base, when you take a look at who's delivering health in their communities, especially community health workers, and then nurses and midwives, easily 90% of that are all women. And then when you kind of go up the pipeline into leadership in academia, in policymaking, in governments, and in the private sector, that pyramid quickly dwindles down and women's representation is a lot less. And we also found a couple other areas. We call this the issue of the pay equity. So there's a gender pay gap, and then there's also an even more pervasive issue, which is that women on the health sector, half of what they do is currently unpaid or underpaid. And there was another Lancet commission that had happened similarly to the time that Women in Global Health was launched, which quantified this economically, that at least 1.5 trillion US dollars annually is what women do in the unpaid and underpaid contributions to the health sector. So this data was also very key to talking about that, the pay inequity is a key driver in the health sector to why women are not being valued and viewed as the leaders they are. And then some of the other things, other highlights I'd say is that, the sector unfortunately also has a very high level of violence, sexual harassment, sexual exploitation. Those things unfortunately have been taboos and not well captured. Many health systems do not actively seek out to capture what is the prevalence of workplace violence, especially the violence that women face. So there are many women that enter and then they find themselves in precarious situations and end up leaving because they have experienced such an event or they're at risk of experiencing such an event. And then the other fourth pillar that we talked about in this paper was occupational segregation. And this really plays into a sector as diverse as the health sector. So women were often segregated into particularly roles such as nursing, bedside roles, primary health care. And now, these are all things we value in the health system, yet we don't show that value in compensation. So women were being segregated into lower paying roles and roles that had less influence. So there's less women in surgery. And so that occupational segregation happens in many different ways. And so these were the four key areas that we identified of why women in a sector where there are so many women are not at the highest levels of decision making.
So take the case of primary care work. What's the sort of connection between somebody being in primary care and being blocked from a leadership path? For people outside the system who don't understand, how all this works.
Yeah, so it's the value we give to specialties in medicine, especially specialties that are procedure-based, surgical specialties. They are seen as having gone through technically the most difficult training, which I would argue as an internal medicine doctor that I disagree with that, given, and you have, as a generalist, and primary healthcare doctors are, whether they're from family medicine or internal medicine or another practice that is feeding into primary healthcare, they have to know every body system and have general knowledge across the board and be able to detect early if something is not going well. So it is a very, very, it's a field that requires a lot of breadth of knowledge and being up to date on that knowledge. But traditionally, we have given more value to the fields of surgery and subspecialties. And so those are the people that will get the invitations to be part of national technical committees, not the generalist. And so this is where the primary healthcare dilemma comes in. The second aspect of it is that the primary healthcare has traditionally not been valued in the last few decades. We are seeing an effort to change that. There's the Almada Declaration that was passed over 40 years ago, making the case for primary health care, but regardless, having tertiary health centers, super specialized care is what is esteemed in society. So that also shapes overall the perception of primary health care as a key aspect of our health system.
So you've done this analysis, you've identified the biggest barriers, then you get to work. Help us understand where you've gotten some traction, what you think is working, and why those things work, those steps worked.
Yeah, so I think the greatest success of women in global health is that has inspired women from all different backgrounds and different walks of life to see this as an issue that affects them and that they want to be part of the change. And so women in global health went from this conversation at a coffee table to the fastest growing women's movement around the world that's focusing on women in health. There are over 60 plus chapters around the world. Majority of these chapters doubled in the COVID years. And so that also shows the fact that during the hardest hit times of health systems and when women were having a double or triple burden of care responsibilities in the health system, they still were recognizing that the issue of gender equity was critical to them. And so I think that's the biggest success, is that when I was having this conversation in my mind and with other co-founders, we never imagined that it would be such a massive global movement that continues to grow. And that's key to catalyzing change. I think some of the big global wins we've had is that now there is a shift in norms. Anytime there's discussions of the health workforce, there is a recognition that 70% of the health and care workforce are women and 25% of those leadership roles are held by women. So that's a fact that the UN Secretary General, to the Director General of the WHO, to leaders from many different governments have now embraced as a fact. And that means that the problem is being recognized. And so what are the wins that we've had that I mentioned? So the first one I'd like to highlight is that the very first resolution that passed at the World Health Assembly on the COVID-19 response included sections about women's contributions in the health sector, supporting them as health workers, viewing them as leaders by encouraging that governments, member states have them as part of decision-making bodies, as part of working groups, and then having a gender-responsive approach to pandemic preparedness and response. And that's went on to shape the discussions also around gender-responsive approaches to global health security. So I think that was a really critical recognition about women in global health work that had the ability to then influence health system change at the national level. The second example I'd use is the high-level meeting on universal health coverage. universal health coverage is part of the Sustainable Development Goal 3 on health and well-being. And when Women in Global Health started engaging with the topic, we knew it was critical to have women and gender equality as a centerpiece. Unfortunately, the global community, when it first launched its six asks on universal health coverage, they were completely gender blind. There was no recognition of women's contributions, no discussions on equity and gender equity. And so we launched a 7th Ask campaign leading up to the first high-level meeting on universal health coverage, and the declaration that passed on universal health coverage at the United Nations due to our campaigning and due to a co-creation across multiple international NGOs, the Alliance for Gender Equality and Universal Health Coverage, we were able to influence member states' governments to pass one of the most gender transformative documents in health globally. And that's language that was integrated into the first universal coverage declaration. And so these are some of the big policy wins, but I would say the real heart of our success is what's happening at the national and community level, where we are having women recognize themselves as leaders, and especially the women that rarely are valued, which are women community health workers. We had a report that we released last year, which talked about how women community health workers, who are the ones that are often unpaid and really, and I'd say substantially underpaid, started engaging with viewing themselves as leaders. And that recognition that a group like Women in Global Health would come in and ask them, what are your views on leadership? And we've seen community health workers go from saying, well, we don't see ourselves as leaders. We imagine a man to be a leader. So they actually, no, we are leaders. We are providing care. We're going the last mile. We are delivering the vaccines. We are reducing maternal mortality. We are the heroines of health in our community. And I would say those are some of the, sort of success stories. And for me, that inspiration at the community level is really the greatest achievement.
Yeah, I'm just thinking, listening to that, in the long game, part of this is getting women to see themselves in those positions, right? Which means probably reaching down into middle schools and elementary schools and starting to shape that mindset that, yeah, women can be the head of a hospital just as much as a man can. What's your sense of that? I mean, is there a lot of outreach being done with younger women to help shape how they think of themselves?
Yeah, it's a great point that you bring up, and it was probably the one I heard the most when I was starting Women in Global Health, that, women just need to lean in. They need to say, I am a leader. And I think that is an issue in certain contexts and realities. But what we find is over and over again that there was already a significant talent pool that was saying, hey, we are ready for leadership. And they kept facing what we call systemic barriers. And so while we need to continue to encourage women to go into health and have themselves view themselves as leaders, what we're facing is really the changes at the systems level. So we had a tagline to this first report that we did with the WHO, which we said, fix the systems, not the women. And that's all about, what's happening at the institutional level, the community level. And it is about health systems and their leadership, saying we're going to have gender equity. We are going to have gender equity in our leadership. We are going to, every time we form a technical working group, we are going to make sure that we have a diverse expert panel. We did this research around COVID-19 where we looked at over 115 countries around the world and their COVID-19 task team composition. So this is at the national government level. And we found that less than 5% had gender equity in their representation. Wow. And so these are the type of things where it's really a systems issue. And the issues that I pointed out early on about what we see in the health sector is the level of violence and sexual harassment. In some of the studies, it was up to 60 to 70% of women in the health sector had talked about having faced some form of sexual harassment and exploitation in their career pathway. So that's less to do with the individual woman saying, I'm ready for leadership. Yeah. And it's more about there are these systemic issues that we're not creating safe workplaces. So, why would someone stay in that environment if they are at risk personally?
Right.
So I think those are the issues that if a health system can really approach it from the multiple levels, and we in our paper go much deeper. So for those that are like, "Yay, I want to go deep into this," we use the ecological model. We talk about barriers at different levels and the solutions and work that we still need to do to continue to understand what solutions work.
Mm-hmm. Now, unfortunately, we're in a period where there's pushback on the whole idea of diversity, equity, inclusion, particularly here in the United States. So I'm wondering how that's impacting your work in this area.
Yeah, so as a sector, global health sector, we are all deeply very affected. I live in Washington, D.C., so for me, it's a very personal issue of seeing the decision-making that's taking place here in D.C. impacting the lives of billions of people around the world overnight. That has been really the tragedy of our times. We've made so much progress from the Millennium Development Goals to the Sustainable Development Goals, even with the challenges that we faced during COVID. So to see such a massive backsliding of commitments to support societies and the most marginalized communities around the world is really heartbreaking. Now, has that impacted specifically the work that Women in Global Health is committed to? It means that the actors in our sector that have been long committed to diversity, equity, inclusion are finding themselves at the crux of how do we do this work without being penalized, losing our funding, being targeted. For a movement like Women in Global Health, we started nimble. For the first 5 years when we were forming, we were completely volunteer run. So our backbone is volunteer run. The movement itself is full of members that contribute what they can. But as a sector, we are incredibly stressed by what's unfolding. So Women in Global Health continues to be a voice on women's leadership and calling for social justice and health justice. And that's going to be a remaining goal. It's a movement. So that is the core of who we are. What we are seeing is a massive pushback on women's rights agenda, especially when it comes to women's bodily autonomy. And bodily autonomy is about women having the ability to choose when and how and if they would like to have children. And so we are seeing a rise in unattended pregnancies, inability to access contraception. We are seeing a rise in unsafe abortions. And that's the reality of what happens when women are not given the ability to make decisions over their bodies. And so this is resulting in millions of lives being at risk and being lost. And I think that's the hardest part for our women's rights organization to witness. But we remain committed to bringing visibility to these issues. I, as a personal advocate on this, and making sure that the stories are being raised at the highest level. So we know that this pushback is not just a headline slogan, but it is resulting in lives being lost.
No, it's challenging times for sure. Before we run out of time here, I did want to have you talk about your role as a young global leader with the World Economic Forum. What's that look like?
Yeah, so I joined the World Economic Forum Young Global Leader program 3 years ago. I'm actually a recent graduate from this week, so you're catching me right at the peak. But it is a community that has a very active alumni. And I was selected into the Young Global Leader Forum. It's a nomination process, and it's been an amazing community, especially in these polarizing times. It's a multi-sectorial community, so the other global leaders that I'm connecting with can come from like the tech sector, from the human rights sector, education, innovation. So it's a very broad group. Artists as well. So it's quite neat to be in that community. But what I found is that this community has been really key to promoting a vision of leadership, which is based on finding commonalities, building bridges, openly discussing what the polarization is and how do we have dialogue and how do we continue to find ways to connect in this global world. And for the work that I do in healthcare, I've had the opportunity to continue to remind these multi-sectorial group that, health is a human right and it is a agreed upon, global value that is a essential building block for anything that anyone does in any sector. And building on that, being able to talk about the importance for these global leaders to remain committed to issues as gender equity and girls and women. So I think right now we need more spaces where we can have dialogue, which we're finding harder and harder in places such as multilateral institutions, the United Nations. There we see the polarized agenda at its peak. But communities such as Young Global Leaders is a thriving community where we are coming together as leaders in our field to find common agenda and to continue to promote this global collaboration.
Well, we're fortunate to have people like you that are still, out there fighting the fight despite all these obstacles. As we wrap up here, we always like to have our guests provide some advice to our audience. So we have a lot of learners in the health professions and early career professionals. And when you're talking to younger people in the health professions, what is your message to them about approaching their careers and dealing with these kinds of issues?
Yeah. So first, I really love connecting with young people. So feel free to reach out to me anytime. But what I say is, in these times, more than ever, take the time to figure out what inspires you and really go deep with that. Because once you have that source of inspiration, whether it is a particular issue in the health sector or a more wider societal issue or problem that has just been gnawing at you, or maybe it is not a problem and it's a solution that you're like, hey, we need the world to get on board with this. Find that inspiration and use that to spark and drive your impact. And don't do this alone. Do this with others. It takes collective action to drive change, whether that is change within an organization or at a community level or more widely at the societal and global level. So be a part of networks, and networks are communities that you get what you give. So if you're active in a network, you're going to get more out of it. So be engaged in those networks and do things in a collective action manner and bring others along with you. The final bit I'll say is that when you dream big and you're building towards that solution, there are moments where it's going to be challenging. There may be pushbacks. There may be a moment where you feel like, hey, I've completely fallen and I don't know how to address this anymore. I'd say, those are the moments that really define your life. Take your time, get back up, reach out to others, people that have been your lifelong supporters and others that you may not know, complete strangers, to take your time to get back up and continue to dream big. We need all of you to be activated. As impossible as the problem seems, it is in these impossible times that we need visionary leaders who are committed to seeing a better world where we continue to collaborate and take care of each other as people, but also take care of our planet.
Well, that's wonderful advice and encouragement for our audience. I want to thank you for offering that and for spending so much time with us today, Dr. Dhatt. It's been a pleasure.
Oh, thank you so much for having me. It's been my privilege as well, and I'll be headed over to patient care in a couple of minutes. So always nice to be able to feel connected to this global community and know that others are looking for connections and we're finding commonalities and we're committed to advancing health equity.
I'm Michael Carrese. Thanks for checking out today's show. And remember to do your part to raise the line and strengthen the healthcare system. We're all in this together.
If you like this podcast, please share it on your social channels. You can also subscribe to the series and check out all of our episodes at osmosis.org/raisethelinepodcast.